Hello, and welcome once again to How Do You Keep Well podcast. And today we'll be talking about a very interesting topic. And I've titled it "Why Mood Swings, Irritability, and stress. Why does it spike in midlife, and especially in women?" Today we would learn all about that, and we have a special guest, and you can see her on my screen. She's ready for us tonight. So thank you once again, Dr. Titi, for joining us tonight. I'm super grateful for your support and also for how much you're going to bring into this podcast this evening. Thank you very much.
Thank you for inviting me, Dr. Jaye. Thank you. It's a great
Thank you.
honor.
Thank you
you.
so much. Many women believe that mood swings in midlife are just part of getting older and nothing can be done about it. But is this true? Okay. And today we will be talking about this and so much more. Now, just before I go on, I just want to tell you a little bit about How Do You Keep Well podcast. Here we unlock the secret to feeling amazing in your mind, in your body, and in your soul. So my name is Dr. Jaye. I'm your host, I'm your cheerleader, as usual, and I'm your guide as we navigate this fascinating world of women's health and well-being this season of this podcast. Now, remember what I always say: if you're ready to laugh, if you're ready to learn, and if you're ready to take charge of your health, you've come to the right place. My mission here is simple: to empower you, to you that incredible lady listening, and also the gentleman listening, to live your fullest, healthiest life. And I believe that when women thrive, entire communities thrive. And my vision is just to create a ripple effect of well being where every episode of this podcast leaves you feeling like, yeah, I can do that. That is easy to do. So today we'll be focusing on the mental and emotional symptoms that women experience, especially in midlife. We know midlife can be a time of positive transformation and it can be challenging too. But with the right support, it can be a stage of life where you can reconnect with your long forgotten dreams, like me, and create a roadmap of the life you want to live. So, today we will be focusing on the roller coaster journey that can happen when hormones begin to fluctuate. If you have ever had premenstrual syndrome, yes, or premenstrual symptoms, you can imagine what can happen if this gets heightened during the transitional years. So, like I said earlier, joining me this cool, calm, serene evening in the UK is the cool, calm, and collected, deeply insightful Dr. Titi Osoba. Dr. Titi works as a psychiatrist at the Kent and Medway NHS Trust. I heard her speak at a women's conference, I think about 2 years ago. Is that correct, Dr. Titi?
I think so, yes.
Yes. And I honestly hoped and prayed for this day, that one day I will be able to do this with her, sit down with her and ask her questions. So, Dr. Titi, before we dive in, can you please share with us a little bit about yourself, perhaps your own personal or professional journey, and how you landed into psychiatry as a specialist job for yourself? I'm just keen to hear. I'm just very curious to know about you.
Okay, thank you very much again, Dr. Jaye. Thank you for inviting me. Really honored to be here. Anything to do with mental wholeness, health, and well-being really gets me talking. It's a passion of mine. I don't believe it's just a work. I see it as a calling. When I went to medical school, it wasn't my intention to specialize in mental health. In fact, what I wanted to do was internal medicine. So when I left medical school, we went to Trinidad and Tobago, and I worked in internal medicine.
Wow.
When we came to United Kingdom, after sitting for the PLAB exam, which you have to sit in order for you to practice in this country,
Yeah.
I couldn't get a job in internal medicine.
Oh.
So it led to a time of reflection. Some of the things that we're going to be talking about today, I could have allowed that to completely, floor me and say, this is the end of me. But like resilient people, you
Yes.
just turn that around. And I'm going to be
Yes.
talking about that today. So I sat down and I asked myself a question. Let's go back to medical school. Let's go back to when you did your rotation in all the specialties. Other than internal medicine, which other specialty did you enjoy, Titi Lola? And I remember that when I did my rotation in psychiatric, Yaba, Nigeria, Lagos, Nigeria, I really enjoyed mental health. Part of my case-based discussion was a lady with manic episode, bipolar affective disorder. That woman left an impression on me. Many years down the line, when I was at that crossroad, deciding what to do, it all just came back to me. And I said to myself, let me go and do clinical attachment in psychiatry. So with the help of my husband, who was already practicing then, we asked the medical staff if they will allow me to just do a month clinical attachment in Ilford. And that was it. I have never looked back. I did a month. The passion came back again.
Oh, wow.
I told myself, this is really what I would like to do for the rest of my life. And it's been a really, really productive journey since then.
Amazing. It's interesting how you made connection with the interaction you had with that woman and how that left a lasting impression. So sometimes as caregivers, as healthcare professionals, we often see ourselves as the one giving healthcare. But in fact, I think a number of people we look after also give us something back. And they help us sometimes discover our passion and the reason why we keep doing this job, despite how challenging it is. Thank you so much for sharing that story. So, going into today's topic, one thing I have found as a GP is that a lot of women come presenting with mental and emotional symptoms. And a lot of this definitely could be due to the way the brain has changed, the way life has changed, the way work has changed, the way their responsibilities have changed, especially in midlife. And many of these women end up being incorrectly diagnosed as having depression. And some of them end up being medicated with antidepressants. And to be honest, it can be quite frightening for some women when they are labeled as being depressed, even though they know they aren't depressed. But they don't understand what's going on in their body. But it can be difficult. So in a way, what do you think? Why do women, especially in midlife, experience more stress and anxiety? What are your thoughts with that, Dr. Titi?
Thank you very much for that question. So first of all, midlife, what age group are we talking about? We're talking about the midway between childhood and old age. Some people say it's from the age of 40, some people say 45 to 60, 65. So a lot of us will fall into that category, midlife. And what happened during midlife, because we haven't got a lot of time and we really want to cover, I'm just going to try and summarize it.
Yes.
What happens during midlife? We have hormonal changes. As women, we're aware of the menstrual cycle, we're aware of the change, the up and down with estrogen and progesterone. And many of us, unfortunately, might have experienced the premenstrual symptoms that you alluded to. Some people had it very severe. They have what is called the PMDD, which is the premenstrual dysphoric disorder. That some people have to be medicated because the premenstrual can present as anger, irritability, mood swings. And if you've ever experienced that before, you will realize what could be the taste of what you experience later in life. So what happened during that period of that we call perimenopause? Again, between that 40 to 55, you have the estrogen fluctuating up and down. Now, estrogen plays a role in mood, management of our mood. Estrogen, we know, is kind of increases the level of a chemical called serotonin, which is the mood altering chemicals, the neurotransmitter that is implicated in anxiety and in depression. He also said that estrogen increases the serotonin receptors in the brain. So we know that estrogen, and he says that the interaction between estrogen and serotonin is quite complex. A lot of the things that happen in the brain is very, very complex. I say to my patients, saying that depression and anxiety is just caused by neurotransmitter is a very simplistic way of putting something that we know is quite complex.
It is.
But let's come back to this. So estrogen is going up and down during that perimenopausal period. Can be heavy. Sometimes you see your period, sometimes you don't see your period. And during that period, perimenopausal, there are a lot of symptoms that we all experience.
Yeah.
I'm going to just mention a few of them. So there are physical symptoms that occur as a result of that fluctuation in estrogen, and there are psychological symptoms. Let's start with some of the physical symptoms and why they can make a woman going through that midlife experience mood swings. Number one, hot flushes, night sweats. A lot of women experience that, and it can significantly impact on sleep.
Yes.
When you don't sleep, it has a lot of impact on your mental health,
Yes.
because sleep deprivation apparently impacts on the transmission of the of serotonin. So we know. So one, a lot of women experience that. When you can't sleep, when you are laying awake, I remember when I went through this. One moment you are opening the window, the next moment you are closing it. You just don't know where you are. That can be quite stressful. The second thing that a lot of women experience is the dryness, the vaginal dryness. That can have a significant implication. Intimate relationship becomes difficult. If you're already going through midlife and you're already having problem in your relationship, that can be quite problematic. So
It
that's
is.
another reason. The third, weight gain. For a lot of women, putting on weight during that period, despite doing everything, that can impact on your self-esteem, your
Yes.
confidence, again,
Yes.
stressful. The last on the list that I just want to allude to under that physical health is the musculoskeletal symptoms that is associated with that fluctuation in estrogen. The muscles
Definitely.
are painful, shoulders, all of that. You're not
Fatigue.
able to sleep, the fatigue, it's impossible to sleep. So all of this, so even the physical symptoms of the fluctuation in estrogen can have significant psychological impact. Then on top of that, because of the connection between estrogen and serotonin, when that fluctuation is happening, it can also cause mood swings, it can cause depression, it can cause anxiety, and it can cause irritability. So we
Wow.
have all of that as a result of the things happening in your body that you have no control over.
Over.
There's nothing that you can do. Once you hit that age, for some of us it's 40, for some of us it's 45, for some it's 50, you have no control. It's just they said it's part of normal aging process that we all
That's
have to
true.
go through.
That's
So you
true.
have that. Then midlife is also a very, very stressful period for all of us. So in addition to struggling with all of these hormonal changes, it can also be a time when there are so many changes going on in our life. It
That's
can be a
true.
time when parental responsibility can change.
Oh,
You become
yes.
the parent of a teenager who are struggling with their own issues, or you are there supporting your children as they transition into university. For some people, a complete loss of that parental role, the empty nest
It's
syndrome. So
significant
that's
too.
another one. The second one is the work-related pressure that we go through. Many of us are going through changes. You're given more responsibility at work. You are trying to navigate a very challenging work environment on top of all of this that you have on your plate.
Yes.
The next one for me is the fact that some of us are in the middle. We've got our children here, and you've got your aging parents here. So you are
Yes.
caught in the middle, trying to
Yes.
navigate through all of this.
Yes.
And the other layer for me is the identity issue.
Oh gosh, that is
When
always a
you are
big
going
one.
through, when you're going to changes that loss of estrogen is doing, there's a bit of loss of femininity. There is the thinning of your hair. For me, it was my hair loss. It was so, and I'll talk about how I deal with that, because I like to be very practical when I'm talking.
Yes. Thank
For some,
you. I like
yeah, I
that.
like to be very, very practical. The things that I went through and how I have navigated through that, I think will be very helpful for some women to hear
Yes.
that. So
Yes.
because menopause, perimenopause affect us differently.
It does.
Affect us differently. So we're very unique in the way, and we all go through it, but the
Yeah.
effect is different.
It
So
is.
all of those things that I have mentioned are what are called the multiple layers of why women go through mental health challenges as they are navigating that process of what we call midlife.
And again, reminds me of what you said earlier, that it's not just a matter of, the neurotransmitters, which plays a big role, but there are so many layers. Earlier on today, I was just, kind of when I was preparing, I came into this information about midlife. It is almost like an accumulation of different impacts of all sorts of different things that's happened over the years. So it is not just that, that season of between maybe 40 to 60, but sometimes the reaction that we're seeing in that period of time is an accumulation of different stresses, different traumas, different events that people have kind of accumulated over that. It's almost like a lifetime experience of different impacts. Do you think there are some people that are then more likely, or are there any risk factors for these symptoms for some women more than others?
Definitely. Definitely. And I'm really glad because I've got that really next to me because I want us to really look at that. So I said something very important. It's a normal aging process. It's what we all have to go through.
Mm,
The question then is, why does it impact us differently?
mm,
And we know in anything in mental health, we always talk about the risk factors.
mm,
We talk about what we call the 3 Ps,
yeah.
what predisposed somebody, what precipitates it, what perpetuates it. Those are
Mm,
just a terminology when I'm teaching medical students and junior colleagues. But let me break down a little bit. So if this is a normal aging process, Dr.
mm.
Jaye, why then do we have women responding to this period of our life, this season of our life differently?
That
The,
that is good. That is one question I always wonder. Why even though we're all in that age group, or
yeah.
perhaps some people younger than us, but why why do some women, is it because of the way their brain, or is it
Yeah.
the trauma? I would be keen to hear from you, Dr.
Yeah.
Titi.
So there's something that I'm looking because I really prepared a lot for this and I really want to make sure that I get all
Thank you
of
so
this
much.
in. So
Thank you.
there is an organization, I'm just looking for it. I found it. It's called the Study of Women Health Across the Nation.
Swan.
Study of Women Health Across the Nation, SWAN. It says that there is the interaction between hormonal changes, and I put here that's constant to all of us, the hormonal changes. The menopausal symptoms, I said here, they're quite variable. So
Mm,
we all experience different symptoms.
mm,
But there are individual risk factors. It is that individual risk factor that is the variable here.
mm,
So some women are more susceptible to depression, anxiety, mood swings, and usually women with pre-existing mental health
mm,
difficulties, mental health diagnoses, mental
mm,
illness, they might be more susceptible. So if a
mm,
woman presents to me, one of the questions that I will ask them is about their past psychiatric history.
mm,
Okay. The other variable is what we call psychosocial stressors.
mm,
And this also is variable and they can exert significant effect as we go through that season of life. What
mm.
do I mean by that? If, say, for example, let me bring us just remind us of what happened during COVID. I think
Yeah,
that's a very good example.
yeah.
COVID affected all of us, but the way we all responded and reacted to it completely different.
Yes, that's
That
true.
was when I came to Limelight. My church asked me to give a talk because we could see the domestic violence went up.
It
We
did.
all know that.
Mm,
Referral to mental health thing went up significantly.
mm,
So what
mm,
happened?
mm,
What did COVID and the shutdown and pulling all of us to live in close proximity? What did it expose?
mm,
What COVID did was to expose the crack that we had that we never knew we did.
mm, mm,
So that crack in our relationship that
mm.
we were just patching up, that we never
Yes.
looked at, the lockdown and being forced to live together expose it. The
Mm,
crack we had in our personality,
mm,
the anxious prone personality, all of those things that we never
mm,
looked at, but we were
mm.
using different defenses. We go to work,
Yes.
keeping ourselves busy.
Busyness of
Be-
life.
COVID exposed that.
Mm,
Now, I'm going to just say the same thing with midlife. I'm not in any way minimizing what some people are going through. But what
mm,
we're looking at is here is that what is it that predispose us to having some of these mental health difficulties.
Mm.
So we know the hormonal changes is constant. We know
Yes.
menopausal symptoms or perimenopausal symptoms could be different.
Yes.
The significant risk factor of having psychiatric history. But there is also another one I put here, I call it the crack in our personality. The things that we never looked at, we never knew it was there before. We will call it your pre-morbid personality. You know, the kind of personality before you hit that midlife. Anxious prone personality. Remember what I said earlier on, that those hormonal changes, the symptoms that they cause could make us feel stressful, but
Yes.
different personality will respond to it differently.
Different ways.
Okay. Anxious prone personality, you are more likely to become more hypervigilant and more stressed. If you cannot sleep, you
Yeah.
are more likely. If you've got a perfectionist tendency, everything in my life must be perfect. The hair must never move out of the way. Everything. You are more likely to respond adversely to some of the midlife challenges. I said here, if you have what is called inability to self-soothe, you just don't know how to manage your emotion. You are one person who emotional roller coaster. One day you are fine, the next moment, then you are likely to be more impacted by it.
Yes. Yes.
If you've got the kind of personality jumping to conclusion, so any little things that you feel in your body, you are more likely to catastrophize and imagine the worst. So the crack in our personality could be one of those risk factors. The other risk factor, unresolved issues. Unresolved issue relationally, unresolved issue. So maybe past trauma. We've
Yes.
never dealt with it. We cover the
Wow.
wound with a plaster, hoping
Oh.
that it will continue to heal. And then suddenly you hit midlife.
And
You
it
have
opens
more
again.
pressure on you. You are expected to give out more. You haven't got that emotional reserve within yourself because
Like
issues in life
capacity.
you've not dealt with. So those kind of things, I said they can raise their ugly head when one is vulnerable due to the hormonal changes causing all the problems that we mentioned earlier on. So
It's like a perfect storm in a teacup,
I
isn't
am
it?
telling you, this same thing that happened. People said COVID. We said, no, it wasn't the COVID. COVID only exposed what we never looked at. It forced some of us to look at ourselves. It forced us to look at our relationship. The referral rate to most of us working in the community mental health hit the roof. And GPs also were very busy during that
It was
period
overwhelming.
because this exposed things that we never dealt with. If you are a woman pre-menopause, I want to say I thank God that you're listening to this. No one said this to us, Dr. Jaye, before we hit that. We suddenly
No.
hit that and we were like trying to navigate ourselves. But if you're listening to us, this is the opportunity for you to take into consideration some of those things that I mentioned and begin to look at that, because whether you like it or not, estrogen will fluctuate.
Yes.
Estrogen will go down.
Yes.
All of that period can be very stressful, but
Yes.
it doesn't have to define you or completely destroy your life. It can be the best period because some of us have decided we're going to turn it around and we're going to use
Absolutely.
that period even
Yes.
to help us to thrive and do some of the things that we've left before. But in order for you to do that, you got to be able to recognize some of those risk factors that I outlined
That.
earlier on.
And one question I have, because obviously many people talk about, neurodiversity and all of that nowadays. Do you think that might potentially be a risk factor? I'm sure it is a risk factor. Or is it possible that even people who were not aware of it, or maybe have had their own ways of coping with it, would that fluctuation, or the way the brain is responding to that fluctuation, kind of open things like that up again as well?
It can. But the most important, Dr. Jai, is to just seek help and just seek that knowledge.
Yes.
I thank God that we live in the age where knowledge abounds,
Yes.
where we've
Yes.
got podcasts like this, where we've got women like you doing things like this. So it's really important for us to be aware and to really acquire that. Some of the things we're going to be talking about under resilience is that self-awareness,
Yes.
that self-governance,
Yes.
educating yourself,
Mm. Mm.
nurturing yourself, going
Mm.
out of the way to
Mm.
acquire the knowledge that you need in order for
Mm.
you to successfully navigate through this
That
season.
period. Now you've mentioned what I was going to ask you next. Is there a science about resilience and self-efficacy that actually helps people during this period? What is the evidence that these things work?
Loads of evidence. And when I was preparing for this, I said I'm going to actually put something here. I'm going to start with a food for thought.
Mm.
Why is it that you have two people facing the same adversity, life challenges,
Mm.
or stressful situation,
Mm.
and then the outcome is completely different?
Mm.
Why?
Mm.
Why? And that's the way, because as doctor, we're scientists.
That's
We
true.
hypothesize
Mm.
and we begin to look for answer. Why?
Mm.
And
Mm.
this is the way that I work. When I read all of those science, all of those research,
Mm.
this is the way so when I see a woman sitting in front of me, I ask myself, what is it about you that has brought you to where you are today?
Mm.
Why have you responded or reacted, whether it's the perimenopause, whether it's the midlife, the way you have?
Mm.
And one of the things that science is saying is one of the factors that determines the outcome is resilience.
Mm.
Resilience. And I'm a very visual person, and I really want to carry, our audience with us.
Yes.
So we have in the middle here, there's something they call the commonality.
Mm.
Estrogen going up and down,
Yes.
midlife,
Mm.
adversity, life challenges is the commonality.
Mm.
On this side here are the resilient people.
Mm.
And on this side here are people who are non-resilient.
Mm. Mm.
One of the things that they find is that the resilient people, that part of that self-efficacy that you talk about,
Mm.
they look at the adversity differently.
Mm.
They perceive it differently.
Mm.
They are also able to look into themselves, and they have this confident assurance and belief in themselves. They have what it takes to deal with
Right.
this adversity.
Right.
So
Right.
self-efficacy is seen as a component of that
Yeah.
resilience.
Mm.
So on this side, the resilient people are the people that say, okay, that's fine. This has been thrown at me.
Mm.
They perceive it as something that is surmountable.
Mm.
I
Mm.
can overcome this. I
Mm.
can adapt to this. I
Mm.
can recover from this. In
Mm.
fact, I might even grow. I'm going to
Through
use this
it.
adversity
Mm.
to grow inside. Now, I'll
Mm.
explain what I mean by that. On this side here, the non-resilient people are the why. Why me? They have this
Mm.
victim mentality. Why is
Mm.
my body going through all of this? Rather than
Mm.
seeking knowledge to
Mm.
understand why that is the case.
Mm.
So that's so you have the commonality here, and then you have
Yes.
the difference. The
Mm.
resilient people is like, how? How am I going to use this season of my life
Mm.
to become a better person,
Person.
to
Mm.
learn,
Mm.
to navigate through this? We
Mm.
know of people who have used this period. They've written books. They've talked about
Definitely.
practical tips. Rather than completely allowing themselves to be drowned by it, they have
Yes.
used it. So
Yeah.
it's really important. That's the science behind it. So when we
Mm.
see people, the resilient and the non-resilient.
Mm.
But some people say, well, what do you mean by that? Some people are just born like that. There's a lot of argument about it.
Yeah.
Some people say it's a mixture of both. We're born like that a little bit, but a lot of it is developmental. It's something that we
Mm.
learn. Some people
Mm.
say, no, it's purely developmental. You just
Mm.
learn it. I'm a believer that it's both.
Yeah, I
Because of
think
what
so
I
too.
said
Mm.
earlier on about the
Mm.
personality. Some
Mm.
of us are personality, we're anxious prone, and that
Mm.
personality could be a bit of what we have brought into this world and a
Mm.
bit of what life has dealt to us.
Environment as
Exactly.
well.
So the
Mm.
nature nurture shape the
Yes.
development of our personality,
Yes.
which
Yes.
then impact on how we face situations that we go through in life.
Mm.
So resilient here, non-resilient here. The other thing that science has taught us and is still teaching us is that mental resilience, mental strength
Mm.
can be developed the same way physical strength can be developed.
Wow. Wow.
So
Wow.
we go to the gym, isn't it? You
That's
don't
true.
suddenly see somebody with big biceps and you think they
No.
were born with that. You
That
go
doesn't
to the
happen.
gym, you eat well, you
Mm,
exercise. The
mm,
evidence is that mental strength can also be built.
yeah,
That there are tools that can be used to make us more mentally resilient.
that's
And I
incredible.
can hear somebody say, well, it's too late for me now. No, it's not too late. It's not
Mm,
too late. Because when you see your GP, sometimes if you've got some physical health, your GP might say to you, change your diet. Your
yes,
GP might say to you, you need to exercise, you need to do
yes.
this.
You need to sleep
Your
more.
GP will never say to you, even though you've got the diagnosis of diabetes or
Mm,
hyperlipidemia or high cholesterol,
mm,
it's too late. It's never too late. It's the same thing with mental strength.
mm,
We can develop that mental strength. The
mm.
brain is that adaptable, and there are tools that we can use to develop that mental strength. Would you like me to mention that, or do you want me
Yes,
to leave
I'm
that?
very, very keen to hear about those tools, the
Yeah,
practical strategies
yeah,
that we can use.
yeah.
There are a few quick other questions. You talked about well, I think that will come later on. But yes, please tell us about this, please, Dr. Titi.
Okay. So the tools are well researched, and we've got that evidence. The brain can be trained to manage life challenges and adversity. I'm going to
Can I
repeat that.
stop you there? So the brain can be trained.
Yes.
Amazing,
It can be
amazing.
trained. There is a quote, if I can find it. Yeah, I got it here. This is a quote from a lady called Amy Morin,
Okay.
2017.
Yes.
Everyone has the ability to develop resilience to stress.
Wow.
It's one of my favorite quotes when
Mm,
I've done this research and given this talk. Everyone has the ability to develop resilience to stress.
mm.
Mental strength involves habits that builds mental muscle, if we could use that in invited comma.
Wow.
So it can be done. The same way you develop that strength physically by going to the gym, by
Yes.
exercising, the same can be done mentally. There are
Wow.
many of those tools when you do the research, but permit me to mention some of the ones that I really love.
Okay.
Number one is, so resilient people, when they do all this research and they pull all of this together, they find that people who are resilient, they are people who regularly change their mindset.
Wow.
I'm going to list them, and I'm going to just 1 or 2 minutes talk about them. You
Okay.
change your mindset
Regularly. Mm,
regularly.
mm,
You learn to manage your emotions.
mm,
Number three, you develop a very positive picture of yourself. Some people
mm,
say visualization. What do you
mm,
see of yourself?
mm,
Number four, self awareness. I can
mm.
talk about self awareness for the
From
whole
today
one
to
hour.
tomorrow.
Self awareness. Number
Mm.
four, relationship,
Wow.
nurturing relationship. And
Mm.
permit me to say, relating well with other people starts with relationship with yourself.
Yourself. Mm.
Learning from experience. So resilient people are people who use experiences, whether positive or negative. In
Mm.
fact, I like what I do. They climb on the stairs of that in order to
Yes.
see what life is got for them on the other side. And then the
Wow.
last one I added today as I was preparing for this is they
Yes.
develop the art, ART, of reflection. They are reflective people.
Mm.
I know as doctors, when we go on all of these courses, they ask to, have you done your reflection? Have you done your reflection?
Yes.
But for
Yes.
me, reflections needs to be part of our day-to-day living.
Mm. Mm.
So what do I mean by positive mindset? Because of time, I'm just going to quickly read them out.
Yes.
Substitute negative self-talk with compassionate and kind self-talk.
Mm.
Change those negative inner monologue that you have about yourself.
Mm.
I said here, I said, the way the mind has been set to view life and life challenges need to be regularly challenged.
Right.
You
So
have
don't
to,
just accept things
don't just accept it.
because that's what it is.
That's
Mm.
what it is. Accept the fact that life is tough.
Mm.
Life is difficult.
Mm.
Estrogen is going to go down if yours has not gone down. Estrogen is going to fluctuate. It's part of normal aging. It's going
Mm.
to happen. When
Mm.
it happens, I might experience some physical symptoms. They're
Mm.
going to be uncomfortable, but they
Mm.
don't have to define me.
No.
I can equip myself with the knowledge that I need to overcome them.
Yes.
If I need to go and see
Amazing.
my GP, if I need to make changes to my diet, whatever I need to do, you change that mindset. It is
That's
not the end of us. Midlife is meant to be positive for us. It's meant to be a time where we no longer have to change diapers and all of that. We no longer have to wake up in the middle of the night. You can
yes.
sleep better. Yes,
Yes.
okay, hot flushes, maybe,
Yes.
yes, but you can sleep better. There's not no
Mm.
interruption. You don't have
Mm.
to run around, looking after them, sitting down with them to do the homework.
Work.
They are more independent. For some
Yes.
of us, they have left home, they have gone to university. So it's the
Yes.
time for you. So change your mindset.
Mm.
Change the way you see life challenges and you see
Mm.
this midlife.
Mm.
Number 2, learn to manage emotion.
Emotions.
This is a big one.
Emotional regulation.
Emotional regulation.
Mm.
Learn the art, A-R-T, of
See.
self-soothing.
Mm.
Self-soothing. In other words, recognize, don't push those emotions down. If the anxiety is there, ask yourself, what's going on? Be
Mm.
mindful. What's going on? Why am I feeling like this?
Yeah.
Name it. I put here, and I'm just going to
Name
quickly
the emotion.
name it. I said, name it, deal with it,
Yes.
own it.
Mm.
Name it, deal
Deal
with
with
it,
it and own it.
own it. It's there. Ask yourself, what has triggered this?
Mm.
What can I do about it? So manage it, learning to manage emotion.
Mm.
Identify those toxic negative emotion and deal
Yes.
with them, regulate them. Pay attention to what is going on. What's
Mm.
going on? Oh, it was because I couldn't sleep last night. I'm feeling a bit cranky today, irritable, short-tempered,
Mm.
screaming and shouting at everybody in the house.
Yeah.
Stay back. Stop. Sit down. Take a deep breath.
Mm.
Ask yourself what's going on. Okay,
Mm.
it was because I didn't sleep. It is not
Yes.
because I've got anxiety spectrum disorder. It is not
Mm.
because I am clinically depressed. I
Mm.
just did not sleep well
Sleep.
last night. Own
Mm.
it.
Mm.
Deal with it. Yeah. And if you have to drop everything you are doing just to go and take a nap, do it.
Yes.
Because
Yes.
that's going to help you. So learn the art of self-soothing. Number
Mm.
3, build a positive self-image.
Mm.
Build a positive. How do you see yourself? I'm a wreck. I'm just a woman. How do you see yourself?
I'm just a mom.
I'm just a mom. That's just who I am. Empty nester. They've all
Mm.
left home. I have
Mm.
nothing, no purpose. One of the
Mm.
things that we also need to be mindful is that a lot of women, they have dedicated their life to bring their children up.
That's
They
true.
have made that decision not to
Yes.
pursue a career.
Yes.
Now the children have gone.
Then
Hormone
is
is
there.
playing a lot of havoc on your mind.
Mm.
Neurotransmitter is up and down. Serotonin
Mm.
is on the low side. You are
Mm.
beginning
Mm.
to question, what is my purpose? That is
Yes.
the time to use that season of life to
Mm.
pursue things that you have left. How do
That's
you
true.
see yourself?
Mm.
Number 4, self-awareness. What do you know about yourself?
Mm.
What do you know about yourself? What do you know about yourself? What do you know about your personality? How do
Mm.
you deal with stress? Are you the
Mm.
sort of person that when you are stressed, you're not even aware that you're stressed? The only time you
Wow.
know you are stressed, you've already gone into the kitchen and you picked up that chocolate or that big bag.
Yes. Stress
You're not
eating.
self-aware. You're
Mm.
not self-aware. You're doing things. You increase alcohol intake or you eat the
Mm.
shop to go and shop. How do
Mm.
you deal with stress? And I really want people to go away. If there's anything you're going to take away, if it's this the only one, self-awareness.
Mm.
I call it the 4 A's.
Okay.
Number 1,
Yes.
it's an acknowledgement of who you are.
Mm.
What are my strengths? What are
Yes.
my weaknesses?
Mm.
What do I know about Titi Lola? I tell
Mm.
you, when I did this, it was an eye-opener for me.
I can
I
imagine.
was
Mm.
meditating one day and I heard in my spirit, you cannot market a product you know nothing about.
Wow.
What
That
do
is
you know
deep.
about the
Mm.
product Jaye and the product Titi? What
Mm.
do you know? It
Mm.
was, I tell you, it was like an eye opener. What do you know about yourself? An acknowledgement of your strength. Be honest with yourself. When you
Mm.
finish listening to this podcast, sit down.
Yeah.
Who is Titi Lola? What
Mm.
are my strengths? What
Mm.
are my weaknesses? You
Mm.
cannot market a product
That
you
you
know
don't
nothing
know.
about. Otherwise, you're
Mm.
an hypocrite.
That's true.
Acknowledgement. Number two, an acceptance of the strength, the weaknesses, the vulnerability, the so good and the not so good.
Yes, it's all
You have
part
to
of
accept
it.
it. This is the totality of who I
Of who
am.
I
I'm a
am.
perfectionist.
Mm.
I have a tendency to procrastinate because I
Goodness. Mm.
always want it to be the best.
Mm.
I get easily
Mm.
fretful.
Mm.
I don't deal with stress well. Be
Mm.
honest with yourself. Number three, take steps to accelerate. That's the third A. The
Yeah, I got
strength.
that. Mm.
That's the third A. Take steps. In other words, focus more. Okay, yes, I mentioned those vulnerability, but there are
Yes.
also good parts of me.
Yes.
I'm a good listener. I'm a good
Yes.
communicator. I'm a good friend. So take steps to accelerate that. The
Yes.
last A, also take steps to address the
Mm.
weaknesses, the not so good. Because
Mm.
if you don't, remember what I mentioned earlier on?
It
The
will come back.
crack in
It will
our
come back.
personality,
Mm.
they can come to the surface when we're
Mm.
going through difficult times.
Yes.
That's why I said
Yes.
I can spend a lot of time talking about self-awareness.
I can see this is a passion of it just comes
Oh
across
my
so
goodness.
strongly.
My
But
goodness.
I love those four A's. Acknowledgement of who you are. You don't, how can you market a product you don't know? That is so deep, and a lot of us hide under titles, not knowing who we are. Accepting that there are two sides of you, there's good, there's weak, there's all sorts, but accepting it, and that's part of being identity. You talked about the identity forming, is all part of that identity forming. Accelerate your goods, address the weakness. Those are, in fact, even that's why I love this. I love the fact that I can sit down at the feet of specialists. I can learn. Learning never stops. And I'm just so grateful for how you are breaking this down. It's getting there. It's getting there, Dr. Titi. Please continue. Let me not stop you.
So again, how do we build that resilience? And it's an ongoing
Yes,
thing. It's a
it
process.
is.
Remember, building is a process. You don't
Mm,
finish building a house in a day. Never
mm,
be impatient with yourself.
mm.
Never be impatient. So the next step, what else can we do? Relationship.
Oh,
They
yes.
said resilient people are people who invest in
Mm,
relationship. They
mm,
nurture relationship.
mm.
But I beg to say that you cannot nurture a relationship when you have got nothing to give.
Oh,
So
gosh.
relationship, nurturing the relationship starts with you, which is why it
Mm,
is important to be self-aware. What am I
mm,
going to bring to the table, Dr. Jai,
mm,
when I don't know anything about myself? What
mm,
am I going to bring into a relationship? This is why most women go into a relationship and they are lost in that. They lose their
mm.
identity because they don't know who they
Who
are.
they are.
So
Mm.
friend A said, let's go to Blue Water today. You jump, you go. Even though you never planned to do that. And you're feeling so horrible. So when you come
Mm,
back and you
mm.
wonder why you're
Why
so
am I
down,
feeling
why you
this
are
way?
anxious. So relationship with others, start relationship with
With
yourself.
yourself. Mm.
How do you see yourself? How I said here, how you see yourself determines the people you surround yourself with.
With. Mm.
Really important. How you see yourself determines the people you surround, the company that you take, that you
Mm.
keep. Sorry,
Mm.
I can tell you a lot about you when I look at the people that you keep.
That's true. That's
Yeah. Do
true.
you surround yourself with people that is going to help you to become a better version of
Of
yourself?
yourself. Mm.
Or do you surround yourself with people that say, don't worry, we are all midlife people. We're going nowhere. Our children have gone. Let's just keep just going around the circle. There's no need to challenge ourselves.
Mm.
There's no need to move forward. You
Mm.
have to, when you finish listening to this podcast today, ask yourself, look around you. Who are the people that I surround myself?
Mm.
What sort of conversation do you have when you call your best friend, your
Yeah.
bestie? What do you
Yeah.
talk about? So
Mm.
really important. Avoid toxic, negative relationship. I
Mm.
put here people who believe in you. They're the one you surround yourself with.
With.
People who are going the same direction. People who
Yes.
speak the same language, and I'm not necessarily talking about speaking the same Yoruba
Tribe
language.
language.
No,
No.
I'm talking about people who speak the language that you speak. The
Mm-hmm.
self-talk that we talked about, mentioned earlier on. People who
Yes.
speak positive into your life. People who
Mm,
speak positive into your future. People who are
mm,
able to look at adversity and said, I can overcome this.
yes.
People who are self-efficacious, like we
Mm,
mentioned earlier on. People who can look at that, people who speak the same language.
mm,
People that you reciprocate, you give, they give. There is that reciprocity in your relationship.
mm,
I says here, healthy relationship with other starts with yourself. So
definitely.
relationship is the next one, and I'm really just aware of time. I knew we're not going to finish this thing. The next
Uh,
one is learning from experience.
yes.
I said here, this is really powerful. Use the experience. Do not let it use you.
Oh, wow. Wow.
Use the adversity, the life challenges. Do
Yeah.
not let it use you. Use it.
As if.
Rephrase it. Turn it around on his head. Use negative experience. Do not let it use you. See failure, mistake as a tool for
For
self-discovery,
growth. Mm,
knowledge, and new experience.
mm,
When I make mistakes, I say to myself, and now this is a new version of me. This is a
yes.
better
It's
version of me.
emerging. Mm,
Yes, a more self-aware of myself
mm,
after I did my 4 A's. Now, if I make mistake, I say, Titi Lola, you have learned another way to do things better next time.
mm.
In fact, I talk to myself. What I'm saying to you, it is not the end of the world. You are
Yes.
not the first person to make this mistake. You will not be the last.
Mm.
Use that failure. Ask yourself the question, what has this taught me about
About
myself?
myself.
Has he
Yes.
exposed that crack again?
Yes.
Do I
Yes.
need to go and plaster it more and put in more cement so that it's solid? I'm not just covering
Mm,
it up, but I'm
mm,
strengthening that foundation.
yes.
So we have to rephrase it and say, I'm going to use this. And then the
Yes.
last one that I wanted to mention is the reflection.
Yeah.
Learn
Oh, yes.
Learn the ART of reflection, the
Reflection.
art of
Art of
reflection.
reflection. Mm,
What happened? What have I learned? What steps can I take? How can I use what I have learned to make me a better person?
person.
So there is a lot out there in terms of what science is teaching us about resilience. And my prayer is that when I see someone coming into my consultation, yes, they have the depression, they have the anxiety. I'm not only prescribing medication, I'm looking at the cracks.
Yeah.
I'm asking them questions. What has
Mm,
happened? And by the
mm,
time they leave, I'm sharing some of this with them.
mm,
You can actually look at this as a positive thing. Yes, you are seeing a psychiatrist. You
mm.
can look at how this has taught you. And for some of them, it is the beginning of me then asking them to go for more therapy to
Yes.
help them to heal if
Mm,
trauma had
yes.
impacted on their personality before.
Mm, mm. And like you said, you were talking about the crack. There are some things that need to be done. Otherwise, if you recognize the crack, but you still leave it there, potentially you start filling it up again and start covering it up again. And to be honest, some of these things, when people talk about perhaps their traumatic experiences or things that have happened in the past or things that happened in the present, I think a lot of it comes with shame. And
Yes.
shame is such a big thing for many people. It can stop people in their track. And that is what you've talked about before in terms of resilience and building self efficacy. That there is a reason this thing has come to the fore, and it's time to heal. It's time to stop using those excuses. When we use excuses, we're using either internal or external things to stop us from moving on. And that's where you might need therapy. Now, Dr. Titi, as we begin to round up, when should people begin to seek professional help?
Okay. I wrote something here, and I just want to quickly read that.
Yes.
I wrote here, where are you now?
Mm,
You are a woman, midlife. You are in that age bracket, 40, 45 to 60, 65, perimenopause, menopause, postmenopause. Where are you? I wrote here, has there been a significant change in midlife for you?
Mm.
which has then increased the cortisol, which is the stress chemical. And we know it's
Mm.
a very damaging chemical.
It
It
is.
can impact on
Mm.
almost all the organs that we have in the body. So
Mm.
I'm asking you this question. Where are you? Has there been a significant change in midlife for you? It's
Mm.
nothing to be ashamed of. Seek professional help.
Mm.
Get somebody that can help you
Mm.
as you navigate through this season. Help you to discover who you are.
Mm.
Help you to discover why this significant midlife season has affected you like
Mm.
this. I said here, has there been worsening of pre-existing mood changes that has now led to anxiety and depression? Please seek help. Has midlife issue exposed or uncovered the cracks in your personality, in your relationship? Earlier on, we mentioned that some of the menopausal symptoms, premenopausal symptoms, I must say, can cause a bit of dryness and make intimate relationship difficult.
Even more difficult.
Yeah, if you have a relationship where there is understanding, where the relationship is the driving you've gone through, you are more likely to be supported. You are less likely to feel stressed and anxious about what could come, what will happen in that relationship. So if this is exposing that, it's not the end of the day. Seek couple therapy. You can hold your hand together as you navigate through this. The relationship can be better. The relationship can flourish. So couple therapy, it's not the end of it. You can go back to your partner and explain what is going. Carry him along. I remember I had to do it. I endure it without saying anything until I had to open up. And now there's a lot of understanding around that area as we support one another. I said here, as there be onset of new symptoms, maybe 10 or 20 years ago, you suffer with anxiety, you suffer with depression. It was just one episode because it was triggered by significant stress. And now, as you hit midlife again, because of some of the things that you're going through, you are beginning to struggle again. Please don't
Reactivated
cover
it.
it up. Go
Mm.
and seek help. I
Mm.
said here, are you scared to seek help because of fear of being judged or being labeled? We don't do that. Your GP will listen to you. Your GP will refer you. You don't necessarily have to be referred to a community mental health team. There are other
No.
agencies there that can support
No.
you.
Definitely.
So it's really important. And I said here, so the clinical depression is real.
It
I
is.
heard the story of a lady. In fact, this is her passion. She's really into a lot of menopause and perimenopause. And she was given, I attended a conference, and she was saying that they were prescribing different antidepressants for this woman until she saw this woman and then she prescribed HRT. And that was life changing for this woman. So seek help. I mean, there are some GPs can go through that with you. I know there are
Yes.
some contraindication, but some people can have that. And
Yes.
HRT has also been shown to help with some of the
Yes.
mood symptoms.
Yes.
And for
Yes.
some people, in addition to the HRT, particularly for those with past history of
Yes.
anxiety or depression, they might also require antidepressant. You know,
Yes.
there
Yes.
is also psychological intervention. Cognitive behavior therapy has been shown
Yes.
to
Yes.
improve symptoms of anxiety and depression. They
Mm.
even say that CBT can improve some of those physical related symptoms.
Absolutely. And it
Yeah.
can actually help with the sleep issues as
Yes.
well, with the
Yes.
insomnia that comes
Yes.
with all the
Yeah.
changes that come.
Yeah. Yeah.
Mm.
So all of these categories that I have put here, I believe that I was kind of led as I was writing that down. So if you're in that kind of category, please seek help.
Mm.
Midlife, it's meant to be a time for us. I haven't got the time to talk about how we could turn it round on its head, what we could do
I need to
during
get
this
you
period.
back, Dr. Titi. I would not agree. All these gems that you have for us, I need to come and grab it out of you.
So we can turn it around,
Mm.
If you're an empty nester, wow, what an opportunity to go back to school. What
Mm.
an opportunity to start journaling your
Mm.
experience, which
Mm.
can turn out to be a book. I
Yes.
read the story of a young lady who faced significant adversity when she was much younger. She thought she had kind of overcome that. She found herself in another difficult, relationship.
Mm.
Rather than allowing herself to drown in that emotion, she began to journaling. And we know journaling is very therapeutic.
Oh gosh,
The
yes.
journal that she was keeping during that period, someone got hold of it. It turned into a book.
Wow.
He's now going everywhere and giving talks. So we can turn it around. We can use this season of midlife and not let it use us. We can
Absolutely.
rephrase it and say, I'm going to climb on the stairs of this season of my life and
Yes.
see what is on the other side for me.
Yes, yes. And I strongly believe, and that is the reason I have focused on midlife health in women. I strongly believe that women carry a lot inside of them, a lot. And it's always such a painful thing for me to see women, especially in midlife, experiencing physical, psychological symptoms stopping them. And I begin to think about the lives linked to them, the families linked to them, the communities, the society, the industries, the organization, the fact that they can be role models to other women, younger women coming up. And that is one of the fire that drives me, that no, I cannot let this woman be lost. Something has to be done. We have to find the right help. We need to find the right person. We need to find the right medication. We need to find the right therapy that will bring you out of this hole. And it's always such a joy to see women coming back to say, wow, thank you for believing my story. Thank you for listening to my story. Sometimes it just takes you listening to that story and telling them, look, I believe you. And you're always never going to end this way. Before we end, there's one quick story. There's one gist you wanted to gist us about your hair. What happened?
Well, so it was a very difficult time. Oh my
Mm,
goodness. It was stressful. The more obviously I was allowing that stress, the more it was getting worse.
mm,
And then one day, I did what I said here today. Change the narrative.
mm.
Change your mindset. I said to myself, Titi Lola, it is not the end of the world. Thank God for week. I'm just being open because I
That's
could have allowed it.
true.
I could have
Mm,
allowed it to move on to
mm,
depression and all of that.
mm,
I just said to myself, it is not the end of the world. Other women are experiencing something much, much worse than what you are going through.
mm,
And I
mm.
know to somebody else that would be a big thing. It was a big thing for
For
me.
you,
But I had
yes.
to come to terms that this is how it has affected me.
It's the new
And
norm.
it's a
Mm,
new norm for me. So I
mm,
got myself different ones
mm,
and I began to wear that.
mm,
So I think it's about the most important thing is to seek help. Thank God I was able to, other women, they go for hair transplant.
mm, mm.
There are things that we can do. And during the times of our parents, they didn't have the kind of nice
Yes.
wigs that we got now.
No, they just
They
tied their gele.
they just tie their gele and they just, so we can. And I remember one day, it was joint pains. Oh my
Mm,
goodness. It
mm.
affects us differently.
It does.
And I remember I was a bit like, ooh. And then I heard on the inside of me, Titi Lola, life is a gift.
Mm,
It's not a choice.
mm,
Be grateful.
mm,
I jumped
mm.
out of myself. I said, Lord, I'm so sorry. Life is a gift. It is
Mm,
not a right.
mm,
Be
mm,
grateful.
mm,
Be
mm.
grateful. We haven't got time to talk about it. People who are resilient, they are grateful people.
Yes.
Be grateful. So all of these things have turned them around.
Yes.
I went to I went to get another wig recently, and I was telling the lady. She said, "Oh, don't worry yourself. Everybody, people come here. When they open the wig and I see it, I make new ones for them.
For them.
Let me make you another one." We turn it into a joke.
Joke. Yes.
We have to do that. I would
Mm,
not have expected that 20, 30 years ago, but it has happened.
no, it
That's the story of
has.
my life, and I'm grateful. Life is a gift.
It
Getting
is.
to midlife, getting to the age that we are today, it's a
Mm,
gift.
mm,
Other women didn't get to this age.
mm.
So if you're in your 50s, if you're about to turn 60 like myself, let's be grateful. Life is a gift.
Wow. Thank you so much, Dr. Titi. I couldn't have done this in a different. I'm so honestly, from the depth of my heart, I really want to say thank you
Welcome.
on behalf of the many women, on behalf of the many husbands, on behalf of the many aunties, and even the younger women who will be listening to this at some point. We want to say thank you.
You're
Thank you for
welcome.
investing so much to teach us, to guide us. And like I said, you are a role model for me and a role model to so many other women. You've said three things: change the narrative, change your mindset, be grateful. And
Yes.
to everyone out there, you are not alone. Help is available. There's
Yes.
nothing to be ashamed of.
No.
There are people out there to help you. There are lots of resources out there. You don't have to see a psychiatrist. You can see a GP. You can see a therapist, and you can speak to your family. Hold your, talk to your partners, your husbands, and they can help you through this. You don't need to hide. There's no reason to hide. It is normal, accept it, embrace it, and enjoy the journey. Do you have any last words for us before we complete today?
Exactly what you've just said is what I want to echo. You are not alone. Menopause, perimenopause, normal aging process. But we're all very unique in the way that we respond to it and the symptoms that we experience. There is no need for comparison. Do not compare your symptoms with somebody else because that's going to make us feel sad. Oh, you
Mm.
haven't lost your hair and I have lost mine. There is no place for comparison. We're very
Mm.
unique, in the way. So embrace your journey like I did mine. Hold the
Thank you.
hand of your loved one and let's navigate through this season together. Thank you very
Amazing.
much for having me.
Thank you so much. Well, you've heard it all from the specialist. On this podcast, we bring the specialists to you. We bring science, we bring strategy, and we bring fun. And we bring real life experiences to you. So thank you for joining us this evening. And once again, thank you to Dr. Titi. Well, you know what to do. Share, like, subscribe, and also send this to somebody you think really, 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 really needs to hear this. Thank you. We love you very much and
Thank
bye.
you. Thank you for having me. Bye.
Thank you. Bye.
Bye.